Good afternoon, everybody. My name is Farayi Moyana, Dr. Moyana, I'm your host. Can we welcome Dr. Christina Sakukanya from Tare? Welcome Pastor Mabani from Domboshawa. Can we welcome Yvette? Yvette, are you there? Miss Gorejena, I believe she's a dental therapist. Can we welcome Irene Moyana? Okay, let's welcome Dr. Mkandona. We have a medical doctor here. We have a medical doctor here on the group. Ladies and gentlemen, welcome to our inaugural Zimbabwe Academy of Dental Nursing Zoom meeting. We are very happy to receive you. We hope others will join by the time we get to 4 o'clock. This presentation is a very informal presentation for the simple reason that it's the first of its kind. We're kind of finding our feet. Then as we go along, we make it more formal. Shorai, finally, I'm sure you are there. Who is Zimbabwe Academy of Dental Nursing? With the acronym ZADENU. Well, as you might know already, Zimbabwe Academy of Dental Nursing is a brainchild of our own dentists here in Zimbabwe who saw the need to professionalize our dental nurses, who personally I affectionately refer to them as our foot soldiers for the profession. Why are they the foot soldiers of our profession? Because they are the ones who manage us. They manage us with all our patients. They are the first to arrive at the dental surgery. They are the last to leave the dental surgery. They receive our patients, they receive calls, they answer queries to our patients, they liaise with the dental laboratories, they liaise with the medical aid societies, they balance the books, they do bookkeeping, they do all sorts of tasks. Some authors argue that they do up to 70% of what the dentist would otherwise be doing. So this allows the dentist to focus on treating the patient. So as you have seen already, the trend worldwide is to make them professional, because for many, many decades, they were seen as people who are just taken from the street. Then each dentist would train them the way they see fit. And when they go home, they don't have that job satisfaction. They don't have that respect. They don't have that prestige, which goes with other paradental and paramedical professionals, such as hospital nurses, dental technicians, dental therapists, dental hygienists, hospital nurses. They lacked that. Just next door in South Africa, the dental nurse now is required to have a minimum training of at least 1 year. And they are required to be registered with the Health Professions Council of South Africa. So as a result, they are protected. Our patients are protected. Our profession gets more prestige, because when our patient comes to the surgery and they see that the gentleman or the lady assisting the dentist has a qualification, has some formal training, is registered, is licensed, then they feel much safer, they feel much confident. And this is what in Zimbabwe we have embarked to do, to catch up with the rest of the world, the rest of the region. We salute the first class that graduated in September last year, class of 23, very strong ladies. We hope more gentlemen will join in, very energetic, very committed. I say that because they doubled up with going to work, looking after their families, and studying at the same time. So how is our diploma course organized? Our 18-month diploma course is organized into modules. I'll just show you an example of a module. There are 4 modules. This is an example of a module. When we started, it was quite thick, as you can see. And we've been improving on the module. And now it looks like it's much slimmer. Well, there are actually 2 of them here. Slim, sleek, and it has got a supplementary small booklet. And that makes it easy to carry, easy to read. So there are 4 of these modules, module 1, 2, 3, and 4. And each one is for a duration of about 4 months. And each module focuses on a particular theme. The theme itself is comprised of several topics. Topics such as cross-infection control, radiology, nutrition, dental practice management, introduction to specialties, and so on and so on. And we take these topics to make up the module from various textbooks. This is an example of a very authoritative textbook. I hope we can read from there. It's an American book, very authoritative in the field of training dental nurses. Here's another book. This is British. So we summarize these books. As you might be aware, not everything in these books is relevant to every situation, least of which is our situation. So we compile the module. The module comes with self-helped tests or exercises or questions at the end in this small booklet here. So as you read the module, you are able to test your understanding of each topic, of each passage, of each chapter by answering the test questions. The test questions are in form of a variety of knowledge testing. Multiple choice questions, true or false, fill in the blank spaces, matching, videos, role plays. So in 4 months to work through that with the help of your dental therapist or dentist or dental hygienist, whoever is your principal supervisor. So at the end of each module, you write a 3-hour exam. The 3-hour exam comprises theory. Then beyond the theory paper, the 3-hour theory paper, you also write what we call an OSC, Objective Structured Clinical Examination. So that's, Jerry, how many hours now? For the exam, that's almost 4.5 hours. The theory paper is 3 hours. The OSC is about 120 minutes. At the end of 18 months, you write a professional exam. And if you pass, you get your diploma. But in addition to the exam at the end of 18 months, you also have to provide the academy with the proof of having done first aid training, proof of having done computer skills. We recommend ICDL or equivalent. And lastly but not least, you need to have done practical work at any dental surgery, preferably in private or in some other place which is acceptable to the academy, where you can be exposed to the multiplicity of tasks. 9 months at least. So in a nutshell, this is the arrangement of the program. This is the structure of the program. Way forward, we have submitted some proposals to the local regulatory body, the Medical and Dental Practitioners Council, to accept our graduates and create a special register for the dental nurses in Zimbabwe. It will be the first of its kind. And through being registered, you'll be able to market yourself locally, regionally, and overseas. Because whenever you apply overseas, the first thing you're asked is, are you registered in your country? I've had inquiries of people who have worked for many years as dental nurses, Zimbabweans in particular, working in Dubai, United Arab Emirates, and also in Australia. And some of them literally beg me to give them a diploma, and we tell them that no, the academy doesn't allow that. But you can see the desperation in your profession, in the dental nursing profession, for this professionalization, so that you can stand tall with your colleagues in the dental team, the dental therapist, the dentist, the dental technician, and you can have a career. With your diploma, we want you to be able to progress for those that we have the energy. Even into dentists, I, for myself, I started off as a dental therapist, and I worked through until I trained as a dentist. So the sky is the limit. But if you just work as a semi-skilled or unskilled, well, that's not to imply that you don't know how to do the job, but that's just how the world is out there. If you don't have the papers, you generally classify as semi-skilled or unskilled, and that's quite deplorable. We feel the dental profession owes it to you guys to develop you, because without the dental surgery assistant or the dental nurse, the profession cannot function, literally. In the next minute or so, I'll open the floor for some of you to give us your reactions or even questions. When you give your reaction, also don't forget to tell us how you've been coping with this COVID issue in the surgeries. Does it mean now we are more akin to the threat? Are we still as afraid as we started in February? I know many of us, we were to close completely, but I realize many of you, despite the hardships, you are going to work. What has made us get this far? Thank you. Okay, Faith, why don't you say something?
Okay.
What's your reaction to what we've said?
I've enjoyed my stay at Borodale Dental Clinic. I think ZADENU is a good academy, and it's offering a good program. But you know, like, I've been in the nursing field. Nurses are registered at the Nurses Council, and we're supposed to register also at the Nurses Council of Zimbabwe.
Okay, thank you very much for your question. Okay. If you remember, in the last few minutes, I did mention submission of our proposal to the Medical and Dental Professions Council of Zimbabwe. This is one council where the dental surgery assistant may end up being registered. The other council is the Allied Professions Council. I think Allied Health Professions Council or something like that. There are about 9 councils in Zimbabwe. Environmental Health Officers Council, the Lab Scientists Council, Nursing Council, Farmers Council, Traditional Healers Council, Rehabilitation Professionals Council, and so on and so on. But our instinct is that since the dentist, the dental therapist, the dental technician are already in the Medical and Dental Practitioners Council, the dental surgery assistant or dental nurse will or would naturally want to be with their peers so that we don't have certain members of the dental team belonging to a different council while the rest belong to the Medical and Dental Practitioners Council. This is the logic behind first approaching the Medical and Dental Practitioners Council. So I've been asked that question, why not approach the Nurses Council? Just because the word dental nurse sounds very close to nurse, the traditional nurse. The problem that might arise is that of coordination. The Nursing Council principally deals with nurses. So what happens when issues, regulatory issues, disciplinary issues, continuing education issues, legal issues arise about the dental nurse whilst they are in the Nurses Council? Faith, can you follow my explanation?
Yes,
Faith,
I'm
can you
following.
follow my explanation?
Yes.
Are you satisfied with my explanation? Does it make sense?
Yes,
Does
it
it
does
make sense? Does make sense. Okay,
Yes.
thank you. Do you
Yes.
have another question, or does anyone else have a question? Or a contribution? Remember, I've just given you a challenge. How have you been coping with this COVID issue? I've just given you a challenge for those who are still going to the dental surgery. All right. So if there are no other questions or contributions, are we ready to clap hands for ourselves? This is quite a very good attendance, you know. Yes, Faith. I think Faith wants to come here.
I wanted to ask, why don't we wear scrubs?
Why don't we wear scrubs?
Yes.
You can and you should wear scrubs, but you need to have enough scrubs. You need to have enough pairs of scrubs so that each day you change into a new set of scrubs. If you notice at Borodale Dental Surgery or even at Baines, I do have 2 pairs of scrubs, but since COVID, I stopped wearing them because I'm putting the gown, I'm putting the plastic apron, and as soon as I arrive home, I change my clothes and I take a shower. But I accept if you wear scrubs, new set of scrubs every day, and when you leave the surgery, you put them off. It's much better than using your own clothes. So as you know, with ZADENU, it's the student's responsibility to provide the uniform.
Okay.
So if you get someone to make a couple of sets of scrubs for yourself with your name branded here on the chest, that completes the profile. That will be quite a good profile, but you need to have quite a number of the scrubs. So those who can afford it increases safety, but it also improves your professional presentation to the patient. And I can tell you, every dentist would want to have you in their surgery. You'll be hit. Yeah, you answered. Yes, so you can go ahead, do nice scrubs, put your name on the chest and everything. Have a few pairs, 3 or 4, so that after 2 or so days, you take them home and you wash them. Can you not have one set? Maybe, but in this day of COVID, I think you need to change. Like I said, with what I'm doing myself, as soon as I get home, before I hug my wife, I remove all the clothes and take a shower. That's the first thing that I do. In fact, as a matter of fact, I have to rush home as soon as I finish work so that I take a shower. That's the ideal thing to do. I think if we had space for those who are building new surgeries, they must put showers as well, so that you shower at the surgery before you go out. Okay, does that answer your question? Does that answer your question?
Yes, I'm answered, Doctor.
Okay,
Thank
you. Mrs. Makusha, are you there?
Hello, I'm there, sir.
How are you? How has the presentation been? Did you find it useful?
Yes, I am finding it very useful.
Okay.
As you know that I'm still new and I still have a lot
to learn.
And so I'm really finding it very useful.
Okay, so we'll meet next Wednesday. You remember, you and Faith, we have a seminar next Wednesday. Let's hope we'll get other people. If possible, let's get other students who can make it to the seminar. We'll put it on the forum so that we have 3, 4, 5 people. It's more interesting when the group is bigger. Always put on your masks, sanitize, and we'll try to social distance.
That's okay, sir.
Right, ladies and gentlemen, we've come to the end of our inaugural presentation, Zimbabwe Academy of Dental Nursing presentation. We appreciate your taking time on a Sunday afternoon like this to tune in. This is the new normal, as they say now in the era of COVID. This is the new normal. You don't know how much I've struggled to set up this meeting, thanks to my, are you a nephew or cousin? My nephew, Jerry, you all know Jerry. Faith, you know Jerry. Yes. Opportunity, you know Jerry. He's a wonderful young man. He's helped me set up this thing. So
yes, I now know him.
Let's clap hands to ourselves. Yes, we did it. Bye-bye.
Thank you. Bye.
Bye.